This is Dr. Seroussi. It's September 18, 2023. I have Melissa here. Melissa, say hello from down there. Okay. All right, and she's been prepped, ready for a PRP procedure. PRP is short for platelet-rich plasma. Platelet-rich plasma means we take your blood, we spin it down, and we enrich the platelets in the blood. Platelets are sort of the unsung heroes of the blood system. They're not the white cells, they're not the red cells. They're smaller cells that help with healing. Like if you have a cut, platelets will crowd to the area, or they'll flood to that area, and they'll try to heal the cut. So some time ago, someone had an idea that if you used platelets in concentrated form, you might heal other parts of the body. For example, if someone's had a whiplash injury in this case, and they have injury to the joints of the neck, which is fairly common, platelet-rich plasma can help heal or tighten up or partially repair those joints. Melissa, you've had, one set of diagnostic injections. I do the diagnostic injections into these joints back here, the facet joints. And if those diagnostic injections done with lidocaine, local anesthetic, help right away, that means we're on the right track. You might ask, why not just get an MRI scan? Problem is, MRI scans show these joints, but injury to the joint or pain from the joint generally is not seen on an MRI. So it's kind of a trial and error, and then finally I do a diagnostic injection if the patient's not improving. She did well with the diagnostics. I then did PRP on one occasion into 2 sets of upper joints, and she was quite happy with that. We're going to go back today and do a second set, this time the lower joints, C5, 6, lower part of the neck, and we're going to do a little bit of a booster at the very upper joints, and we'll see how she does. This is now a fluoroscope. It's a moving X-ray. And I'm using this needle just as a locator. So I'm going to put that on Melissa's neck. You okay there, Melissa? And then I'm going to try to find where that shows on the camera. And so it's showing a little bit high here. It's that long line there. I'm going to go a little bit lower, and let's put a little more cut out, a little more downward tilt, please. Okay, picture. And that's starting to look where I want to be. So I'm going to go a little bit lower still, Melissa. Okay, I think that'll be good. And then we're going to take a needle, and this is a 2-inch needle, a cervical spinal needle, and a little bit of a poke here. Okay, Melissa? You ready? Poke here. How you doing there? Good. I'm trying to correlate right now where the needle is, both on the surface of the skin, as well as in the picture here. I'm trying to get into some level about here. And that little black line, if you can see it, is the needle as it is inserted in the patient's body. And this is, by the way, the platelet-rich plasma. From Melissa, we spun down her blood, and we concentrated the platelets. This is from about 20 cc's of blood, and it's about 6 cc's of PRP. So about 3 or 4 to 1 ratio. Fairly efficient system we use here. You hanging in there, Melissa?
Yeah.
Okay, we're going to want your arms down by your sides soon. Now, can you tuck them in under your pants? Okay, good. Picture. And now let's bring the whole unit up. Picture. Okay, here's the back of her skull. There's C1, the top cervical. C2, 3, 4, 5, 6, and 7 is down here. Hard to see because of the shoulder. I'm going to target that needle towards the C2, 3 level. Picture. So there's C1. Let's bring her up a little bit. Picture. Okay. So I'm trying to get right to that level there. So I'm going to use the needle guide with the fluoroscopy. We have to respect the fact that there can be a medial or side-to-side drift. C2, C3, there's the joint. The concern is I have to make sure in the side-to-side or medial-lateral direction I look pretty good. And it looks like I'm moving a little too on the inside. So I'm going to come out and just go a little bit further out. That looks better. Let's have a look from the lateral again. So it's just a process of going back and forth. And once we're pretty happy with placement, we're going to take a little bit of this contrast dye, a little bit of pressure here. Picture. And that looks pretty good. I'll talk the viewer through this, and then maybe we'll call it good. That shows that I'm getting into the joint with the dye. That black here shows that I'm also in the ligaments behind the joint. But that's fine, because that's probably where part of the pathology is anyway, according to what we understand. So now I'm just going to inject the PRP, feeling like my placement is pretty good. Then we're going to move on to the next joint. So the patient has a little bit of a TENS unit here, a little electrical stimulator that can help. We put it on her back. Sometimes that can help with the acute pain.
All right, is that too much or is that okay?
All right. So I'm going to take that out now.